Hello, everybody. Good evening. How are we today? Where are we watching from? Where are we dialing in from? Just let me know in the comment section. It's good to have you all again. I am excited to be here. I know we had fun last week, Friday. So please let me know. Where are you viewing from? Facebook, YouTube, what part of the world are you viewing from? Let's see the comments rolling in. Good evening, everyone. Hello, 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 hello. I hope I'm not alone. Don't leave me alone, oh. Don't leave me, don't leave me. I need all of you people to be with me here live. Let's do this together. This is the final Pre-Value Me event. Woo! Who else is excited? Is it just me? Am I the only one? Anybody else? Come on. Ooh, watching from Facebook in the car. Hope you are not the one driving. Hope you are not the one driving. Oh, joining in from Texas. Wow. Hello. Good morning. Hi, watching from Akure. Oh, you're so welcome. It's good to have you guys. I need to see more comments coming in, guys. Oh, I am excited as well. I am excited. That's good. That's good. How have we been? How have we been? How are we all doing? Hope you are doing well. We're keeping fine. We're keeping safe. Oh, hello, Bamisaye Oluwatoyin. Hope you are good too. Hi. Hello, hello. Good to have us here. Please, share to your friends. Let your friends know we are live. Let them know we are live. Oh, watching from Sangota. That's nice. That's nice. That's nice. Lovely, lovely. Oh, good evening, babes. Olubumi. Good to have you. Ooh, seems like more people are watching from Otta. Great, great. That's lovely. That's really lovely. Wow. Like I said, this is our final Pre-Value Me event. The past 2 Fridays, we've been having different talk shows and different people have talked about different things. And today is the final one before the main event. Watching from Port Harcourt City, UAR. Lovely, awesome stuff, awesome stuff. That's good, that's good. I'll just give another minute before we proceed for the day. Another minute. Whilst we're waiting for others to join in, whilst people are sharing the links, for others to join in. Who can tell me when is Value Me 2021? I feel like doing giveaway, but I don't have the powers to do giveaway. Who can tell me when is Value Me 2021? Let me know the true babes we have here. I should expect by now the comments will have just been flowing with the dates, like everybody just coming. Pa, 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 pa. Live from Lagos, watching from Ikoyi, watching from Sangoi for Zone. Lovely. Who can tell me when is Value Me 2021? It's round the corner. We're almost there. Who can tell me the dates? You might just be amazed. Watching from Port Harcourt. Welcome, Josephine. Woo! Somebody got it. Well done, Esther Joko. Well done. It's on the 5th to the 8th of August 2021. Hope you've told everybody about it. Yeah, 5th to the 8th of August 2021. It's going to be exciting. It promises to be really educative. And there's the real giveaway that period. So honestly, you guys you ladies should all be looking forward to it and be excited about it. Yeah, watching from Abeokuta. Oh, lovely. Good, good. I like the fact that we're watching from all over, That's really good. Then, lastly, guess what? There is a beer challenge going on. Who is participating in it? How many of you are interested, or how many of you have signed up for it? Drinking water challenge and walking 30 minutes daily. Who is up for that? I don't want to believe it's only Pimo doing it. Who else is up for that? It's going to be exciting. I love the post I saw this morning, and it told us all the reasons to drink water. So who else is joining in? I think it's a good challenge. What do we think? Let me know in the comment section. What do we think about that challenge? Drinking water, no soda, walking 30 minutes for the next 7 days. Ha, good, good. Baby Lupumi is on. She's in. That's good. That's good. Any other person? Any other person who is on that? Oh, quite a number of you. That's good. Exciting, exciting. I'm really pleased. Please encourage people in your zones, to get involved, participate in that challenge. It would be really, really exciting when we have it as a group and all of that. So it would be really, really exciting. So please don't take it lightly. Make sure you're participating. Ooh, someone said she's been on the no soda challenge for 4 months now. Ooh, you're doing very well, babes Josephine. Well done. Kudos to you. That's really, really good. That's really, really good. Well done. Well done. See, it's doable. It's really doable. Instead of buying soda, you buy water. Instead of hanging on to the next cup of coffee or, the next cup of juice, drink water. It's cheaper. You will save money. Oh. You will thank us at the end of the day. Anyways, who can remember last week we talked about the effect of abuse on other people's health, and I felt the major take home we had last week was the fact that we should be kind to one another, because you never can tell how far or the impact to which your words can go to affect somebody else's life. And I felt that was really good. It was also nice, having to learn that as simple as neglect is, it's a form of abuse. Since then, I've been very careful and very cautious about people around me, and like, oh, hope I haven't just not forgotten this person. I've not just done things anyhow. That was really touching for me, and it gave me a new perspective. Guess what? Today we have another exciting topic, and we are talking about STDs. We're talking about HIV and STDs. And with us this evening or morning where you're from, or afternoon, any part of where you are around the world, we have Dr. ENEFO Emorua joining us this evening. Dr. ENEFO Emorua is the founder of Colors of Hope Foundation for Good Health. She's passionate about health education and provision of health care and education for children in undeserved communities in Africa. She's also a member of the West African College of Physicians. Please, babes, let us give a babes welcome to Dr. ENEFO Emerua. Come on, let's welcome her.
Okay. Good
Hiya, good
evening,
evening.
everybody.
Good evening.
Good
So good to
evening.
have you.
Good evening, everyone. Hope we had a nice day. Good evening, my beautiful host. I don't know your name.
Edak is the name.
Ella.
Edak.
Eda. Okay,
Yeah.
nice to meet you.
Nice to
Yeah,
meet you
so
too.
I'm grateful for the opportunity, grateful for being given this opportunity to talk about health. Yeah. Thank you to Pastor Maureen, the our mama. She doesn't like people calling her mama. Our mama of Babe Redefined. I'm grateful for the opportunity, Pastor Maureen Oshumakinde. I'm grateful for Babes Redefined, and I trust that we're going to have a wonderful time learning this evening. Yeah. So any opportunity I'm given to talk about health, I usually create time for that because prevention is actually better than cure. Everybody knows. So
Absolutely.
there was someone I was listening to once, and they were like that the best doctors are the doctors that can actually prevent a an illness than treating. Like if somebody comes and says that I prevented 300,000 women from getting cervical cancer. I think that person has really done really very well compared to someone that has treated 100 people for cancer. I don't know if you understand my point. Yeah, prevention is
Absolutely.
less, is cheaper, it's more comfortable, it's easier, and it's just the way forward. Yes, so I'm really grateful for this opportunity to share about sexually transmitted infections. So we're going to be talking about. Can I go on?
Yeah, sure you can. Sure
Okay.
you can.
Yeah. So today we're going to be talking about sexually transmitted infections. What are sexually transmitted infections? They are infections that spread predominantly through sexual contact. Sexual contact, vaginal contact, anal or oral sex. But some of these infections can also be transferred through non-sexual means, such as blood transfusion and other blood products. You know that sometimes when you are ill, you can be transfused with blood. Yeah. So if that blood is infected, you can get some of these sexually transmitted infections through the blood. They can also be transmitted from mother to child. Yeah. So that's another way in which um, these infections can be transmitted. So, and that's a very good reason also why I like and I really, really am glad about this presentation because Babes Redefined is for women. Women have a very, very major role in preventing infection from spreading to their children, even on the unborn child, in the mother, baby still in the womb, still enjoying itself and all that, that baby can be infected through the mother. So it is very important we know about these infections. Yes. So there are more than about 30 different bacteria, viruses, and parasites that can cause this infection through sexual contact. But eight of them are the troublers of the world. Eight of these bacteria and viruses are the troublers. They are the highest cause of these infections. Four of these infections, four of them are treatable, while four of them are not treatable. That's why, like I said initially, prevention is very important because if something cannot be treated, if you can prevent someone from getting that, then I really think that project or whatever program has been very successful. So the four treatable, I'll just list them. We're going to talk about them, and as we go on, the four treatable infections are gonorrhea, syphilis, chlamydia, and trichomonas. Don't bother about the name. Don't worry, you will understand as we go further. Yes. So while the incurable ones are hepatitis, herpes simplex virus, HPV, and HIV, these ones they don't have a cure. They don't have a cure. So it's very important we really discuss this. So four treatable and four non-treatable: syphilis, gonorrhea, chlamydia, trichomonas, then hepatitis, and so I'm just going to pick the ones that really really affect women. There's out of these eight, that really affect women. They affect the unborn child. Yeah, the ones that can really affect the children and women. Yeah. So why are we talking about STDs? Why do we bother talking about it? What is the importance? How is it affecting the world? Why should we bother to discuss about it here? So, like if you remember, I said that four of them are treatable, four are not treatable. So um currently worldwide more than 1 million people are affected with STDs daily, not monthly, not yearly. Every day, up to 1 million people affected with sexually transmitted infections, STIs, every day. As in, you wake up in the from morning till night, 1
Nice.
million people worldwide are affected with STIs.
That's
Yes,
a
and
lot.
every year. Hello?
Yeah, I said that's a lot.
Yes, that's a lot. That's why it's important we discuss these things, yes, and prevent them. So each year, there's an estimated 376 million new infections with one of the four STIs, as in out of chlamydia, gonorrhea, syphilis, and trichomonas, 376 million new infections are 376 million people are infected every year out of from this four of them, as in chlamydia, gonorrhea, and
Mm,
trichomonas. Then more than 500 million people are estimated to have genital infection with herpes simplex virus every year. HPV is the human papilloma virus. It's the virus that causes cervical cancer. Yes, I'm going to talk about that a lot because we are women and it's important we know about that. So 290 million people have been infected with HPV, that's this virus.
mm,
And the majority of STIs, they don't have symptoms. You won't know they have, you won't know you have these STIs. That's why, again, prevention is better than cure, because you can have the STIs might be in your body, damaging your cell, damaging your organs. You won't know you have it until you have the major complications. For example, a woman can be infected with the human papilloma virus that can cause cancer. She won't know she has it until she starts having symptoms of cancer and all that, and you go and check and see that this virus has gone to the cervix and changed the cells, and it's irreversible. Yeah, so it's very important we discuss this. And most of these STIs, that especially syphilis and herpes simplex virus, it predisposes people to have HIV. Yeah. So it's very important to discuss them. 900, don't be scared about these values and don't be bored about me mentioning these values. The numbers of people is affecting, because it will tell you how important it is. You may not have it, but your neighbor, your friend, your colleague may have something like this, and you can be of help. You can be of help, and you know how important it is, yeah, to prevent, to treat
mm,
immediately. Yeah. So another thing about health education, because most I know people say STIs, I don't need to know about it. I'm faithful to my husband. My husband is faithful to me. I don't think I'm prone to it. But the beauty about health education is that the information you are getting from health education may not be from you for you, but your neighbor at work tomorrow might just come to you and say, I don't know what's wrong with me. I have this sores in my vulvar region, or my breast is hard and this and that, and she doesn't know what it is. But someone that is educated and knows about this and just say, change in your breast, please, hospital, let's start going. And you find out that you'll be able to save that woman from breast cancer, save her breast, save her children, save her, because when a woman dies, the children, in fact, except somebody brings someone to help those children, you know that nobody can really take the position of a mother
mm.
in the child. So every woman is important. Men are important too. Here we're talking about women here, so let's not even go that way. So 988,000 pregnant women were infected with syphilis in 2016, and this resulted in over 350,000 adverse birth outcomes, including 200,000 stillbirths and newborn births. In fact, the babies were not even 200,000 of these babies of mothers that were infected with syphilis were not even born. They died in the womb, and um, including out of that 200,000, some of the babies died at birth, as in within 28 days. So it is very important to discuss this. That's for syphilis. While in some cases, this STIs cause serious reproductive health consequences in the women, such as infertility. We're going to get there. We're going to sit there and discuss that. Yeah. So, and also mother to child transmission. So Mother child transmission of STIs, like I said, it can, if a woman has STIs, it can affect the child very, very seriously. There are cases in the hospital where we see mothers, they have hepatitis, or they have some certain infections, and we give them instructions, please do this and that. And sometimes they go against those instructions because they don't know the consequences. Even if when we tell them consequences, they feel that or they will apply the blood of Jesus, or they will pray, or they will use
No.
some other ways. But this knowledge is given to us by God, and for prevention. Yeah, the knowledge is given to us by God, and for prevention. So it is very important for any woman that has infection. It can transfer to mother, like I said, and this can result in stillbirth. The baby will not even be born; it will die in the womb. The baby can die at birth, the first 28 days or more. The baby will have low birth weights, and then the child will be born small for age, will not grow well. The baby can be born prematurely instead of staying for um 37 completed weeks in the uterus, 9 months. Baby will come earlier than that. And the baby coming earlier than that, that is already a risk factor for so many things, because the baby is not ready to be born. And if a
Yeah.
baby is not ready to be born, come out, find out that in this our environment, it's only God. It is only God, because in some centers there are no incubators, there are no respirators, there are no even manpower to take care of newborns that are premature. So, like I said, prevention truly is better than cure. We need to prevent all these things. The babies can come out with infections, pneumonia, they can have conjunctivitis, and worst of it, the babies can even have congenital problems, that the babies will not be well formed. Babies will not be well formed, and you can imagine if you have a child that is not well formed, the stress on the stress on the family and all that. So I will keep saying it, prevention is better than cure. So we also have approximately 1 million pregnant women estimated to have syphilis in 2016. Okay, I've talked about this. Yeah, so let's talk about HPV infection. This is human papilloma virus. This is the virus that this causes cervical cancer. It has caused in 2016, it caused 570,000 cases of cervical cancer and over 300,000 deaths from cervical cancer in 2016. While infections such as gonorrhea and chlamydia, these two, they are very important in the women. These two infections, if you have gonorrhea or chlamydia, most of the time, they can occur at the same time or individually. This can cause infertility in women. Are you with me? They can
Yeah,
cause
yeah.
infertility in women. So it's very important. So you can imagine someone, she was 18, she had infection, she had this gonorrhea or chlamydia infection, and she it wasn't properly treated, and it went up and damaged her tubes, damaged her uterus, and all that. And when she's married 35 years, and she found out that she can't take in because of an infection she had it while she was 18 or 16. So these infections are really, really very important, because it can affect your reproductive life, can affect your family, can affect your life. There are so many things that can be prevented. Yeah, so let's talk about syphilis briefly. Currently, I've not seen any case of syphilis. It's not so common in this our environment, but it's good to mention it, and it's good to know a symptom of syphilis. When you have an ulcer, it's painless. An ulcer is like a wound in your vulvar region. Vulvar region is the outer part of your, now the vulva, the vagina. Most people call it vagina, but it's vagina is actually inside. So the vulva is the outer part where you have the labia, we have the clitoris. So
Oh,
that's the vulva area. So the vagina is inside. That's the vulva. So if you have a sore there, a wound there, as it's painless, please don't overlook it. It could be syphilis, yes. And they also have secondary. It could be primary. It could be secondary. Secondary, after some time, you could have rash and some other things. It's very important in pregnancy, because if someone has syphilis in pregnancy, you can be treated, and it can be prevented from being transmitted to the baby. So it's very important. So the next thing we're going to talk about is chlamydia and gonorrhea. Yeah, these two infections, they cause what we all know as, they could cause what we all know as PID, pelvic inflammatory disease. This pelvic inflammatory disease, I'm sure almost or majority of women have heard about pelvic inflammatory disease. Yeah, so it's caused by two organisms, and we are so grateful that we have treatment for chlamydia and we have treatment for gonorrhea. So it is very important to find to if you have it, present in hospital and get treated. So what is pelvic inflammatory disease? It's infection of, okay, I would like to say that there are other organisms that can cause PID that are not sexually transmitted. In this talk, health talk is about sexually transmitted infection. So that's why I'm narrowing down to chlamydia and gonorrhea. There are other infections that can cause sexually transmitted infections. So PID is the infection of, I'm going to break it down so you can understand, of the female reproductive organ. Yeah, so the female reproductive organ has the ovaries, it has the fallopian tube, it has the uterus. I hope my host, please hope my grammar, my medical terms are not too much.
No, 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 no.
Yes,
We
I'm
are
really going to
actually
break.
getting you. We are actually
You are
getting
getting
you.
me. Hope you are understanding what I'm. Yes.
Yes, we are.
Okay. Yeah. So,
Thank you.
the female reproductive system is made up of the ovaries, the fallopian tube, the uterus, the cervix. Yeah. So, infection of any part of this female reproductive system is um, is called, yeah, pelvic inflammatory disease. Yeah, so the inner lining of the uterus can be affected, what we call endometritis, salpingitis. Let me just not bore you with those names, but just know that it can have any infection of the ovaries, the fallopian tubes, the uterus, inner part of the uterus, and the cervix, under the umbrella of pelvic inflammatory disease. It can also affect the inner part of the abdomen also. So, what are the risk factors? What will make me have this infection? What will predispose me to having these infections? When you have especially PID, when you have an infection and you don't treat it because there's the lower genital tract and the upper genital tract. This PID is actually the infection is actually upper genital tract. That's the tubes and all that. That's the upper part. So when you have an infection in the lower part and you don't treat it, it can now migrate to the upper part. That's upper reproductive tract. Yeah. So
Okay.
when it goes up there, it spreads. Yeah. So you can have the STDs. So that's why, like I said, number one, prevention. Number two, early detection and treatment. Early detection and treatment are very important. So if you have an infection, a sexually transmitted infection, you don't treat it, it stays in your body for a while. And at this point, I would like to say that it's not all the time that you have symptoms for these infections. Now, sometimes you might be infected and you won't have symptoms. You might have an infection, you won't have any. What are symptoms? Symptoms are your body, are what your body tells you that something is going wrong in it. For example, if you have malaria, let me use a common disease, malaria, you will
Mm,
have headache, your body will be hot, you will vomit, you will lose appetite. So those are symptoms. But
mm.
this infection, sometimes they won't tell you, your body won't tell you that something is going on. It will just be there,
Wow.
destroying your the uterus, destroying the fallopian tubes and all that. Or sometimes they just give you some mild symptoms and the symptoms might stop, but it's there. It's you go up there and keep destroying the tubes, creating some funny tissues that will block the tubes, infections in the uterus, and all that affect the ovaries also. So it's
Okay,
so you
sorry. Just before you proceed,
okay,
what kind of things are we expected to look out for, especially
okay,
in the
I'll get
case
there.
where you said we're not having symptoms? Because how would I know something isn't right or something isn't
Yes, I will
good
get
down
there.
there? Okay.
Yes, I'll get there. After talking about what can predispose you to PID, I'll talk about how to know if you have an infection. So having
Okay.
more than one sexual partners also predispose you to this infection. Then having sex with a partner that has other partners. It's so funny. Most times people say that
I'm faithful.
patients they come and they say, we ask them, how many sexual partners do you have? They say it's only one. So that patient has one sexual partner, but that patient's partner has
Partner.
other partners,
Multiple.
and that patient's other partners have other
Yes.
partners. I don't know if you understand me. So the infection is just so having sex with more than one person, that is a risk factor. Having sex with somebody that has other partner, that's a higher risk factor. So like this Baby Define is a Christian organization. So like when God told us in the Bible that we should flee fornication, we should abstain and all that. Most of those rules are for our own benefits, truly. Because if you abstain, if you are married and you stay faithful and all that, most of all these things you may not really have issues
Okay.
with. And still, like I said again, health education is not only for you, it is for you, your environment, your family, your co-workers, everybody around you. So I hope we're on the same line. So if you have had PID before and you didn't treat it, you are predisposed to having it again. Then being sexually active before the age of 25. There's this 25-year the WHO. This my guidelines are from the WHO standard verified protocols and all that. So there's always this belief that before 25 there's this recklessness and all that adventurous mindset and all that before 25. So there's this. So they say if you are sexually active before 25, you are more likely to have more sexual partners and all that. Someone that starts having sex at 18 has a boyfriend 2 years. The next year you have another one. The next this and that, and you are sleeping with all of them. You are more likely to have. Maybe you now at 25. That's okay. Let me start thinking to get married and all that. So someone that's sexually active before 25, you're prone to having this. And this thing that we call douching, washing the vagina, it is not necessary. Washing it is there are soaps that is there in the market, for washing the vagina and all that. It's not necessary. It actually predisposes you to infections. Yeah. So there's also if an IUCD, which is a birth control method, if it's introduced to you and it's not done properly, it can introduce infection to the womb and all that, which can lead to PID. So how do I know I have pelvic inflammatory disease? Number one, you have pain.
Hi, Doc. Sorry, just before you move forward, yeah. I think I want us to talk a little more about washing that area because there've been so many misconceptions about it, and like
Okay,
you said, there are some of these brands out there that will tell you clinically tested and all of that. So how do we wash that place? What is the right way to wash
okay.
around the vagina area?
Yes, like I said, the vagina is inside, the vulva is outside. So you don't need to wash the vagina, honestly. You don't need to put your hand there and be washing it. It has a natural cleansing
Mechanism.
mechanism that God has created there. Yes. So you just need to wash the vulva area, wash the surface with soap, mild soap. Just
Okay.
wash the outer part. Like I said, the vagina is inside, the outer part is the vulva, where you have the clitoris and all that. So you don't need to wash inside, you don't need to stick your hand or
In.
whatever to be washing inside the vagina. It's not needed. Yeah, I
Okay.
don't know if I've answered your question.
Yeah, that makes sense actually. Yeah. So
Yes.
we just wash around the labias and
Yes.
all that, and you don't need to insert in
You
to
don't need
wash all
to
those places. Okay.
No, you don't need to insert anything to wash. Yeah. So how do I know if I have PID? You have pain, low abdominal pain. You
Mm,
have pain. Yeah, you can have a fever. So in some cases, you can have a temperature because it's an infection. Your temperature can be high. You can have a discharge, as in discharge from the vagina. You see it on your underwear. Could be foul smelling. Yeah, most times it's foul smelling, and the color, because every woman has a normal vaginal discharge, which is odorless, it is whitish. Yeah, but this the discharge for an infection, it is bad. It has a bad odor. It is not creamy. It is not white. It is it could be colored. Yes, it could be much. Yeah, then you could have pain. Yeah, pain during sex. Yes, especially if the cervix is infected. You have pain during sex because there are two types of pain during sex. We call it dyspareunia at entry and when the penis is inside. So during when the penis is inside, yeah, that is deep dyspareunia, that's deep sexual pain. That is a symptom of PID, not at entry. Yeah, there's some at entry of the vagina, there could be some pain, maybe when there's not enough lubrication, retention, fear, and all that, and some other causes, but that is not PID. But when deep pain, call it deep dyspareunia, yeah, pain during sex, not at penetration. So burning sensation when you urinate, you have pain when you urinate, then you could bleed during your period. So when you see your doctor, you lay your complaint to your doctor. Your doctor will ask you, what are your complaints? He'll ask you, he'll now examine you and all that. Let me just say a little bit of that. So, like I said, it's health education. So when you find your doctor doing this to you, you know that it is normal. So he will examine your stomach, your abdomen, yeah, check for pain and all that. If we want to do a digital examination for you, digital vaginal examination with his fingers, his or her fingers, to check if the cervix is tender. Yes, check. So when he dips, he or her penetrates with your vagina to check inside, you may have some pain there. Yeah. So don't feel uncomfortable if you go to the hospital presenting with a sexually transmitted infection and you have symptoms and they ask you to take off your pants and then they want to
I
examine
know.
to, yeah, be comfortable and know that the doctor is doing the right thing. Yeah. So complications. So treatment. I'm not going to go into there's treatment for PID. The treatment has to be early, it has to be on time. If you have these symptoms, please go to the hospital. They will do all the tests, make a diagnosis, and give you treatment. Yes, the doctor will treat you on time. Make sure you complete your medication. If you take some of these drugs, at the second day you may be feeling better already. Complete your drugs. That's one of the cause of recurrence and even further damage to the uterus. If you take the drugs and you don't complete the drug, the infection is not completely gone. It's still up in there and it's damaging your organs. Yeah, so complications. I think what are the complications of PID? You could have tubal blockage. I'm sure you've heard many women tell you that I can't. The doctor said my tubes are blocked. There are so many things that can cause it, but the commonest cause is infection. This is one of some of these sexual transmitted infections. Say my tubes are blocked. The doctor said my tubes are blocked, and you need for some form of, yeah, there are other ways in which you can get pregnant, but for the normal way in which, sorry, the one way, let me not say you can get pregnant through IVF and all that. There are other methods, but the natural way, yes, those ones are artificially. God has given us wisdom to know how to carry out IUIs and IVFs and all that. But the natural way, the eggs need to pass through the fallopian tube. So you need your fallopian tubes to be open. So these infections can go and damage those fallopian and block those tubes. And if those tubes are blocked, there's no way the eggs will pass through and to the uterus to get implanted for a baby to be formed. So it's very important. And to also let you know that you don't need your two tubes to be patent for you to get pregnant. If one tube is still patent, you are fine. You are fine. So just make sure that you don't have another infection that can damage your other tube. So another complication could be ectopic pregnancy. If those tubes are blocked and there is a fertilization, the ovaries have produced eggs, the sperm coming, and there's a fertilization, you have a fertilized eggs, and it can pass through those tubes. So the egg will now go somewhere else and go and sit down. That's an ectopic pregnancy. The fertilized egg is outside of the womb, it goes out and sits somewhere else and starts growing. But because that place is not the normal place the egg is supposed to sit and grow, it will just grow for about 4 weeks, 2 months maximum, and it will rupture. It will rupture, and ectopic pregnancy have killed so many women. It has killed so many women because the bleeding, the pain, and all that, it can be really devastating and it can take a life. So that's why, like I've been saying from the beginning, prevention is better than cure. Prevention of these infections. Yeah, that's not the only cause of ectopic pregnancy, mind you. Just this is a cause. Any fertility, we'll talk about that. If the tubes are blocked, if that affected the uterus, and uterus is um, um, not patent enough to receive an egg, can cause infertility. Then it can also cause long-term pelvic pain, as in recurring pain, pelvic, that's your lower abdomen. It can cause long-term pelvic pain. PIDs can cause that. PID can cause that. So how do you prevent it? Like we've mentioned alongside ABC. One, abstinence. If you are not married, wait. Wait till you get married. Don't sleep around. Yes, and in a situation where, like I said, this is a Christian organization. We preach abstinence, but in a situation where maybe a new convert and you're not yet there, you could use a condom. Hmm. Use a condom, or maybe in a situation where, in an unfortunate situation, maybe where your husband is not faithful and you feel that he might bring an infection to you, you could use a condom. So A, abstain. B, be faithful to your partner, to your husband or your wife. Then using of a condom can prevent us from these infections. So I want to quickly go into hepatitis. Hepatitis is a very, very important topic. It's not usually talked about, but it's a sexually transmitted infection. It affects women, it affects children, very importantly. It's if a woman has it and it's not properly taken care of, it can affect the child. It can lead to, it's one of the causes of liver cirrhosis and liver cancer in adults. Yes, something that happened to a woman. The innocent child gets the hepatitis, and in adulthood it can haunt you back down to adulthood. Yes. So why hepatitis? One of the statistics very important. I say this that so you can know how important this is. 2 billion people have been affected with hepatitis B, and 1 out of every 3 persons, one out of every, if we are three in this room, 1 out of every 3 persons, there's a likelihood that 1 out of every 3 persons have hepatitis B. It is that important. It's even more people have hepatitis B more than HIV. Yes, but it's not really talked about because the symptoms are not as glaring as HIV. It doesn't really kill as HIV. It just, if you are in some people, it just progresses to I'll tell you the statistics of how many percent um, can progress to cirrhosis and to cancer. Yeah, so that's why most times people don't talk about it. They have it and there's no symptom, just there. It's just that the virus is just there chilling, talking to that virus is interacting with your liver, changing your liver, destroying your liver. And in adulthood, you find out that you have cirrhosis. Cirrhosis is a liver disease caused by the virus goes and change the normal texture and structure of the liver and can lead to cancer. So 30 million people become infected each year. 30 million become newly infected each year. 300 million people are chronically infected. I don't know if you are hearing my values, the values I'm saying. And less
Sure.
than 10% of people infected have been diagnosed. Out of these 2 million people, less than 10% of these people know that they have hepatitis. They've not done a test, they don't know that they have the virus. The virus is not disturbing them, it's not making them feel ill or sick, but the virus is sitting with them, destroying their liver. In some cases, when they have chronic hepatitis, it can be transmitted to innocent children and all that. So approximately 2 people die each minute from hepatitis. 2 people every minute. A
Wow.
minute is 30 seconds. So 2 people are dying every minute from hepatitis B. It is very, very important, and we are so grateful that we have a vaccine that can prevent us. We'll get there. Yeah. So transmission. How do people get hepatitis B? The commonest cause is from mother to child. Mother to child transmission. The mother has hepatitis B, gives it to the child. That's why in pregnancy, like, as many of us have been pregnant, when you come for antenatal, we screen you for hepatitis B, we screen you for HIV, we screen you for other infections. Why? Because we are trying to stop mother to child transmission of hepatitis B. If we can stop it at that point, stop it and prevent a child from having hepatitis B, we have saved that child from chronic disease.
Mm.
5% of people, 5% of 95% of children that have hepatitis at birth or in infancy or early childhood progress to chronic hepatitis. 95. That value is terrible. It is really, really bad. If a child gets hepatitis at birth from the mother or within 1 year of
Mm.
age, that child has 95% chance of developing chronic hepatitis, which can cause liver cancer. Are you with me? And liver,
Yeah.
the liver is only one liver that God gave us.
Mhm.
Now renal failure, there are two kidneys,
Yeah,
we
there's those two kidneys, but we
donate,
have
there's
just
scope
one
for that.
liver.
Yes, we have only one
And
liver. So that's
the
why
liver is
we,
really important, you know?
yes, yes. So that's why we
Wow.
must keep talking about this. We must keep, and I think 2 days ago was World Hepatitis Day. They were free. If you in your community, there might still be free hepatitis screening, and if you're negative, please you can take the vaccine. Yeah. So what was I talking about? Okay, transmission, mother to child, very important. This is the highest means in which hepatitis transfer is transmitted. Then also blood, if you take a blood that has hepatitis B, needle injuries, tattooing, manicure and all that. Then contact with body fluids such as the saliva. If someone has hepatitis and is active and the person's saliva gets in contact with another person, that person can have hepatitis. It's different from HIV. If someone has HIV and the saliva come in contact, you will not have, but the hepatitis B virus is in the saliva, it's in the menstrual blood, it's in the seminal fluid, that is semen, the male semen. It's in
Yeah.
vaginal secretions is there. So there are so many ways in which you can get hepatitis B compared to HIV. So hepatitis B is more contagious. Yeah. So okay, I've talked about the chronicity. So if someone gets it, like I've talked about, if someone gets hepatitis B at birth or within 1 year, there's 90% chance of getting it, of having chronic hepatitis. Then if the person gets it in adulthood, you just have 5% chance of having chronic hepatitis. Chronic hepatitis cause the liver, cirrhosis, and cancer. And this is why we strengthen and we emphasize on vaccination of children in for hepatitis is very important. That's why we're always on it. It's in the vaccination schedule for children. It is free. Yes, it is free. So I just want to chip this in. If a mother has hepatitis, what do you do? Is it that she should not get pregnant again? She can get pregnant at birth. The child is what we got immunoglobulin. The child is given immunoglobulin at 20 within 24 hours, and also immunized. And the child completes his routine immunization for hepatitis. The mother also, there are some investigations they'll do on the mother to see if the hepatitis virus is high in her body. They can give her some viral drugs also to reduce the viral load and prevent transmission. So there is hope. There is hope for anybody that has hepatitis. It's not curable, but if you have it, there are some viral drugs we can give you and to reduce the
Management.
viral load, and it can reduce your risk of being having chronic hepatitis, which can cause liver cancer. So prevention, I just talked about the vaccine. So a child that has gotten the vaccine has to complete the vaccine at birth, 6 weeks and 10 weeks or so. I think six birth, six and of 6 4 and something. I can't really remember the fine details of that, but it's all in your card. Every mother has that card. Everything is there. So you take the vaccine. Even adults, if you like the World Hepatitis Day that we just did now. I think there's some centers, there's some programs, screening of hepatitis. If you are negative, you should take the vaccine. You should take the vaccine. The vaccine will protect you. There are 3 doses. Make sure you complete those 3 doses. It will prevent you from having hepatitis, contracting hepatitis. Yes. So there's also this same thing. If, for example, if two people, because this is a woman, a female gathering and all that, if there's a single hepatitis, sorry, a single woman, you want to get married, you have been in love, blah 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 blah. Because at the beginning, when the love wants to start, you will not say, oh yeah, let's go and check HIV status or check hepatitis status and all that. So if somebody that you're about to get married has hepatitis, yeah, there are tests they will do to know if the hepatitis is active or not, and the person can go on some viral drugs. Yes, and person that doesn't have hepatitis, the person that is negative, should take the vaccine, protect themselves, and you guys are going to be fine. So it's not a death sentence. It's not a like, oh, don't finish matter. Are you with me? So that's why health education is very important. Early detection, first of all, prevention. You prevent it by taking your vaccines, by don't involve in multiple sexual partners, be faithful, abstinence, um, use of condoms and all that. So yeah, so where are we now? Okay, let's go to the human papilloma virus. This is another virus that really affects women. The human papilloma virus that causes cervical cancer in women. So this virus is a quiet virus too. You can get it from it actually affects the mouth. There are various types. There are various types, but the type that causes cancer is the type that goes to the genital area and cause cancer over there. It can cause what? Genital what? When you have genital what? Know that it's important to treat it. It's caused by this HPV virus. Then how do you get it? Skin to skin contact of the genital area by oral sex, vaginal sex, anal sex, sharing of sex toys. People that use that predispose you from having HPV virus. Like this virus doesn't have any symptom. Doesn't have any symptom. You just find out that if you have it, you might just have you might progress to cancer. Yes, so it's very, very common. This human papilloma virus is very common. Yes, and most people have a various type of it in their lifetime. It could cause, like talked about, it cause genital warts and all that. So how do you prevent it? Prevent it by using condoms and your vaccine. There are two doses. 2 doses. They are very important. Vaccination. And the funny thing about this vaccination, and the very important thing, while yeah, like I say, I really love health education because it saves a lot of trouble. Saves a lot of trouble. I know there are so many people here who have daughters that are 9 years, that are 11 years, that are 12 years, that have not had the human HPV vaccine. Yes, and the age in which the vaccine is most effective is 9 to 12 years. You have to take it, the vaccine. Every young girl from 9 years, 9 to 12 years, you need to take it 2 doses. And peradventure, your child is 15 and has not taken it, you need to take 3 doses. We increase the dose, 3 doses for over 6 months. You need to take that. If you are over 25 to 45 years and you have not yet taken it, you can take it. You can still take it, but it's not going to be as effective as if you took it at 9
Yes.
to 12 years. I hope I'm clear. And should I repeat that? Every young every young girl, 9 years, when your girl gets up to 9 years, she should go and she should get it's not a free vaccine, it's paid. And at why 9 years? Because the major way in which HPV vaccine is transmitted is sexually. So vaccinate the child before they are sexually active. Yes, vaccinate child before they are sexually active. In this part of the world where abstinence is being preached, yes, we say 12 years, is she going to be exposed? Another, but in some other parts of the world, by 9 years or in some abnormal cases in Nigeria and all that, maybe abuse and all that, some 9 year olds can be active already and all that. But by 9 years in some other parts of the world, they put it is that low because things are happening. You know what's going on all around the world. The norms are becoming the norms are now becoming how am I going to say that? Our the norms, the standards are shifting. Yeah, let me say that the standard is shifting. Where abstinence usually preaches, they say no, 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 absolutely. Give them condoms, let them be free. Abortion, they should have, it's their body, they have the right to and all that in the Western world and all that. So at 9 years, vaccinate your child between 9 to 12. If at 15, give it, there's still some potency. But if you like at 27, within 27 to 45, okay, let me put it back 26, you should, it still has some good cover. The percentage is reducing as the age increases. When you take it at 26, it's not the same as when you take it at 9. So you can also still take it at within 25 to 45. Yeah, but it will not be as effective as when you took it at 9 years. So I'm just going to briefly talk about HIV now. Like HIV, HIV is like everybody knows about HIV, kind of. Yeah, it's a major global problem. It has been there for a while. Then recently, I was reading about HIV. I was like, this HIV is now an adult compared to what's happening now, COVID and all that and all that. If you compare transmission of HIV to COVID, you know HIV has actually you need to the transmission, but COVID, you might be just sitting on your own. You have not pulled your clothes. You don't have multiple sexual partners. You don't have nobody has pricked you. You have
Mm.
not. Do you understand? So
Yeah,
HIV is an adult to me. Oh. Compared to even hepatitis like and all that, or COVID that you just sit down in
you're
your room,
your own.
you're on your own. You don't even
Somebody
move your
sneeze
mouth.
and that's
Yes,
it.
you don't move your mouth for 5 minutes, and somebody just did sneeze, and you just get you understand what I'm saying. So HIV is
Yeah.
a big boy, it's an adult. So but it's still very, very important because it affects women, it affects children. Yeah, the statistics are still high. And we have drugs for HIV. We have drugs for HIV. It's not curable, but we have drugs. Yeah, so um, what does it do? So let me just mention the statistics. 37.7 million people are living with HIV. Yeah, two-thirds of them are in Africa. Yeah, so um, 680,000 people died from HIV in 2020, last year, 680,000. So what does it do? What does HIV do to the body? HIV is the virus, human immunodeficiency virus. It goes to the body and starts um, destroying the normal immune system of the body. It starts breaking. There's something they call CD4 count. It starts destroying the CD4 count. I'm just trying to explain in layman English. So it reduces the ability of the body to fight infection. It makes your immune system so weak. And after the HIV has destroyed the immune system to a level that tiny infection, something that will not even affect someone without HIV, will just infect the person, and you see the person just comes down with AIDS. That's acquired immune deficiency syndrome. So the virus causes the individual to have a weak immune system. It's like a paper, like okay, a tree a tree that is healthy, and ants get into the tree and start eating the trunk of the tree, start eating it up, and before you know it, the tree that could withstand winds and rain and all that, because the trunk of the tree is now weak, a small wind will just blow and the tree will fall off. So that's kind of what HIV does. Any infection that your body would have naturally fought or would have not been so devastating will happen, and you see that the person falls so ill and all that. So how do you get it? Protected sex, yeah, through people that have other sexually transmitted infections, yeah, can predispose them to HIV, especially STIs that causes ulcers, yeah, can predispose patients to HIV. The sharing of sharps, needles, and all that, blood transfusions, and all that can predispose. Prevention, use of condom, testing and counseling is very important, because if you know you have HIV, the earlier you know and you start taking those drugs, the better for you. Yeah, because in those days, most times when somebody has HIV, they come with AIDS already. because there were no testing. People were scared to test. People were not aware that there were drugs. That HIV is not no more a death
Death
sentence per se.
sentence.
Yeah, if you have HIV, you take your drugs, you eat well, and you are going to be fine. You can live as long as you want with the grace of God and all that, with the drugs and early detection. So you use your drugs regularly. You don't share sharps, and prevention of a mother-child. HIV can also be transmitted from mother to child. Yeah, but with the drugs now, like I said, if a mother has HIV, yeah, there are certain drugs we can give to the mother and it can reduce the transmission to the child. Yeah,
Mm,
so that is all I want to say. Like I talked about HIV too in marriage, breastfeeding. Yeah, I just want to chip in that because we are women who say that when you have HIV, you should not breastfeed, you should not do this. But with the drugs and if when you take the drugs and your viral load is actually low, you can actually breastfeed your child. There are certain rules, there are certain protocols you follow. Tell you protocols in the hospital. You can breastfeed your child. If you are at the point of marriage and you see someone that has HIV and you feel that God has given you a word or something, it's not a death sentence. It's not a You don't have to run away. There are certain things that can be done that you can still get married if you have the faith. And if the person is on drugs and the person has the viral load can be actually zero. If the person takes the drugs regularly and the viral load is low, yeah, the risk of transmission to an uninfected person is actually really, really minimal. So there is hope with HIV and with God too on your side. So I don't know. That's all I have to talk about. I don't know if
wow.
you have any questions or any other thing we
Wow,
want
wow,
to.
wow, wow. Thank you so much. This was really, really enlightening, honestly. And like you said, this information is not just limited to us as individuals, but when we know it and we pass it on to every other person around us, we're helping and we're saving lives in return. So that's really good. I know you said for HIV they could be on medication if the mother is infected and that can still allow her breastfeed. Is that also same for hepatitis?
Yes, it's safe for hepatitis. If the
Okay.
child, because when the child is born, there is immunoglobulin we give to the child, and the child takes its vaccine. The child is protected, and like I said, the mother is going to be they're going to run some tests to know if the mother is actively. There are certain tests we run on anybody that has hepatitis to know if this person has an active infection, if the baby mother has a chronic an inactive infection. So that, and if it's active, there are certain drugs we can give the mother to reduce the viral load and reduce the infectivity. So by the time we've done that, it will reduce the rate in which you can the percentage in which you can transmit to the child. And the child is also protected with vaccine and with immunoglobulin too, so we are good.
Okay, great. Thank you. So our viewers, if you have any question, just type it in the comment section and I'll pass it on and let me know what are your questions. Any questions you have, anything that you thought, oh my God, how can we handle this? How can we sort that? Just let us know in the comment section and we would attempt to answer them for you. Great. Okay, so while we're waiting for questions from the comment sections, I've had quite a number of, thoughts to myself, while you were talking and all of this. And especially for, like you said, when we look at our vaginal fluids and discharges, you could actually tell to say if something is wrong or it should be an indicator as to if you need to see your doctor. So, are there instances where we could just notice something and just, would I say, have home remedies to it? Or is it at every strange sight that you see on your panty liner, you should be running off to the doctors?
Yes, yeah, I think Like we always say, every woman, they say every woman knows her body.
Mm,
Yeah. So the moment you see a strange discharge, you know that this thing is not normal. This is it's not usually like this. So anytime you see such, it's good to go to the doctor. Yeah, it's good to go to the doctor because it can be anything. It can be an infection, even if it's not an infection, it's good to always check. It's good to always check. Like
mm,
for example, every at some points in the cycle, you will see the discharge might increase a bit. Yeah, during your ovulation or
yeah.
non-ovulation, it's thick. It could be watery, not thick, and all that. Some people don't even observe that, but if you notice anything abnormal from the normal they usually have, please see your doctor. Very important.
Okay,
Better
great.
for your doctor to tell you that there's nothing wrong with you than for you to sit in your house
At
and
home.
incubating infections and
True.
yeah. So like I have
Absolutely.
been saying, prevention is better than
Ratio
cure.
is really
Yeah.
important. Yeah. Wow. Thank you. So someone is asking, how can we support our loved ones who are HIV positive? Hello? Oh, I think we've lost her due to network. Hello, Dr. Meru, are you still with us? Okay, I think network is kind of bad. But from the general outlook, let me attempt to answer this question before she comes back on. How can we support our loved ones who are HIV positive? Like she said, encouraging them that, having that virus is not a death sentence is a good start. We can start from there, just encouraging them and letting them understand that this is not a death sentence. Whilst it cannot be fully treated, we can still manage the condition, we can manage the situations. So, therefore, encourage them to take their drugs and all of that. Encourage them to have a good and healthy diet and lifestyle because I feel that your diet and lifestyle would help also. Because remember, like she said, HIV, it's something that suppresses your immune system, so you need to be on top of your health. So if you know anyone who is HIV positive, encourage them to lead a healthy lifestyle. you know that the kind of life they would be living should not have anything to do with alcohol, drugs, and all of that. So they should try maintain a healthy lifestyle, try to exercise every now and again, stay on top of their drugs, and just be positive around them generally. Don't make them feel like it's the end of the world. Don't make them feel like they've lost it all. Because, like she said, a person can be positive and still give birth, you know, to a negative child, pending on everything. So let's be encouraging to them and see. You would be amazed that um you'll be amazed at how much your positivity around them can go a long way. I hope that has answered your question. Okay, doctor, we have another question for you. Okay, so okay, okay. I think we're having a technical situation here. Just give me a second, and I'll try to bring doctor back online. Okay, so someone is asking, in Nigeria, we consult pharmacists when we notice things. Is it okay to just accept and use whatever they recommend without seeing a doctor for a thorough examination? Wow. Okay. Let's see. Let's see. Oh God, network, help us to get doctor back online. Um. Okay. While we're trying to get doctor back online, I will just quickly attempt on this and say, if you have seen your pharmacist and your pharmacist recommend something to you, I would say go with your pharmacist recommendation. And if for any reason things are not improving, then it's worth going to see a doctor. But I don't think it's a bad idea. You could always go with your pharmacist recommendation, except it's something that is severe or so. Yeah. Okay. I don't know. This network is not very born again this evening. How can we be going all smoothly? And then at this point, it decides to leave us hanging. Not very nice of the network. Okay, okay. So while we're waiting for doctor to be added back onto the stage, is worth letting us know that it's such an honor to have all of you here joining us for the past 3 weeks. I am so grateful for you guys taking out the time to come, and listen to these talks. And I would like to believe we have all learned a thing or two. Like she said, prevention is key. So imagine this knowledge you have. You now let the next person next to you know. You inform the person next to you, inform the person next to you, and this continues on. Think about how many people we would prevent from having these issues. And because when you think of those statistics, um, Mado, it's a lot. Those statistics are loads. So imagine if we can keep up with doing all these things, informing people, letting people understand the implications of all of these, of staying on top of their health. That would go a long way to reducing the statistics. And that's what we are aiming at. And that is what our goal is with Value Me 2021. We're looking to handle and look in depth into women's health. So, like we said, it's happening on the 5th to the 8th of August. We'll have more conversations around our nutrition and diet. We'll have more conversations around reproductive health. We'll have more conversations around mental health. And we'll also have conversations around health insurance. So, honestly, watch out for the flyers and plan to attend. Plan to attend if you can. Watch out for the flyers, plan to attend if you can. That would be really helpful again. Like I said at the beginning of the show, we are having, you know, we're having a soda-free challenge. So water only and having an exercise for 30 minutes, a walk for 30 minutes a day for the next 7 days. So um yeah, we're having that challenge. Participate in your zones. And like we said, you'll be amazed. There are giveaways, exciting things we have in store for you at Value Me. And stay tuned. Don't miss it for anything. Don't miss it. I know it's going to seem like a lot, but trust me, you will be blessed. You will be glad you did attend. So, let's say a big thank you to, to our doctor for spending time giving us quality information and all of that. And also, just to chip into what the question regarding consulting pharmacies. Ideally, pharmacies are not meant to diagnose, and they don't really are not. It's not in their place to diagnose your illness. So if you are ill and a pharmacist sort of gives you recommendation, it's always still good to see a doctor for proper treatments, just to answer that question more accurately. So when your pharmacist gives you a recommendation, it's always good to see a doctor for appropriate treatment. So once again, thank you so much, Dr. Emerua, for your time. Thank you for the information you passed on to us. And we are so grateful and we're so glad that you had the time to spend with us. Such a shame that network kicked you out and all of that. But we are really, really glad and we're really pleased that you were able to join us this evening. And so, to our viewers all around the world, once again, thank you for joining us. And I can't wait to have you all next week from the 5th to the 8th of August for the main Value Me event. Stay blessed. Remember, keep on top of your health, share information about health, and remember, prevention is key. Prevention is key. Try to prevent illnesses rather than trying to treat them. So, if you can prevent them in the first place, it's a lot better for you than trying to treat them. Until I see you again next week, do have a lovely and a glorious weekend. Stay blessed. Love you. Bye.